Hi everyone and welcome back to my channel. So in this video, I'm going to be talking about some of the options to get a high paying job as a mental health clinician. Now, for the purposes of this video, a mental health clinician is someone that's within the fields of counseling, social work, marriage and family therapy, or psychology, and has some type of advanced education, graduate school, and possibly an independent clinical license. However, a lot of the roles I'll be talking about do not require a license at all. All right, so we also have to define high paying before we get started. So high paying would be really quantified as about 75,000 or above. Right now, 75,000 is kind of the median for a lot of healthcare providers, especially mental health providers. And so above 75K would be above average, which would be kind of considered high paying. However, you also got to think about the rate of salary, the hourly rate, also the benefits that the job is providing, and the time commitment of the job. So, for instance, if you're always on call or if you're working long hours, what you're getting paid may not necessarily fit the money that you're getting paid versus the time that you're expending. So those are all things to keep in mind when it comes to kind of defining high paying. Also, the benefits. Does this company have unlimited PTO? Do they offer tuition reimbursement? Do they offer full health insurance with benefits and 401k and retirement? Those are all part of the benefits package that really should come into consideration when you're kind of defining a high paying job and really deciding what's going to be the best fit for your needs. So one of the big ones is that of healthcare when it comes to high paying jobs. And so I have some options here and some examples here. As you all can see, IOP, PHP, outpatient, specialized disease navigation services. I will say that I've seen really high paying jobs in the specialized disease navigation space. And that's specifically because a lot of times people are donating to nonprofits and causes around finding a cure for a specific diagnoses. And so a lot of times they're a lot more open to paying social workers, but also mental health clinicians more to work with individuals in kind of a specialized setting. Additionally, patient advocacy, being an ombudsperson, that could be in a hospital, that could be working for a state or your local state. That could also be working within a local city as well. Also, inpatient behavioral health can open up a lot of different opportunities. You can work as a therapist, you can work in admissions, you can also work in discharge planning or case management. A lot of times in those roles, there is room for advancement and room to move forward. So you can get into maybe some of the leadership positions and also management when it comes to inpatient behavioral health. So that's one of the options to get into a role that's more high paying than maybe some of the more traditional roles. Also, home health and hospice can be high paying depending on what state you live in and the hourly rate. One thing I like specifically about home health and hospice work is that it typically tends to be fairly flexible when you're able to make your own schedule and really kind of put things the way that you want it to be without a whole lot of oversight. So if you're looking for something flexible but also something where you could really work non-traditional hours, home health and hospice can sometimes be a really great fit. If flexibility is something that's really important, it's kind of taking the driver's seat on your job search. And if you're looking for something in healthcare, it's definitely something to consider. Another option is working in higher education. Now, you'll notice that I did not add adjuncting to this list because adjuncting is notoriously kind of on the lower end of things. I think it can be hard to kind of get your toe in the door, and adjuncting is can have its ups and downs, but it's not always high paying. And so I don't have it here, but it's definitely something that can be high paying if you teach a lot of classes or even if you work at different institutions. But some of the more high paying options when it comes to higher education would be working in academic administration, being a head of department, whether you're the head of social work, the head of the social work department, the head of counseling, the head of some other center, or the head of a counseling center, or you're a dean or assistant dean. These are all roles that tend to be more on the high paying side of things. It also matters the size of the school that you're working in. And some of these roles can also be remote depending on the makeup of the school that is offering these roles, and a lot of them are also on ground too. So when you're looking for high paying roles, don't go past the on ground ones, because those can sometimes be some of those diamond in the roughs when it comes to finding a job that has work life balance, but also gives you enough flexibility to do what you need to do while also having a salary that meets your needs. Additionally, I am saying counseling, and I know that this goes without saying, and a lot of us are already working in this space. These are some of the things that I've seen when it comes to working with counselors and seeing providers that have high levels of income. And this doesn't necessarily have to be a comprehensive list, but everybody I've met that makes a high income in counseling has had at least one of these things or these bullet points in their practice. So one was independent license in multiple states. This can be really crucial when it comes to just maximizing your income potential, because different states have different levels of income and different cost of living. So if you have a license in a state that has a higher cost of living, typically their reimbursement rates are higher because people are typically paying a little bit more for counseling in those states. Examples of that would be, on the East Coast, let's say New York, Massachusetts, Rhode Island, Connecticut, and also California tends to be on the higher side of things because it does have a higher cost of living. So those states, when you have a license in those states, you're a lot of times able to negotiate sometimes higher rates because there's a higher cost of living. Also, having steady referral sources and contracts. A lot of times when it comes to, getting a high paying role or just being an entrepreneur in general, a lot comes down to having steady referral sources. Do you have kind of a current or a steady client caseload? And do you have contracts that ensure that you have a client caseload so that you're not necessarily always having to go out and get clients? Also, a well marketed niche or being an expert in some way. So if you found, the best way to do something, or you have a well marketed niche, let's say you focus on, millennials that are working, long hours and struggling with depression, that could be a well marketed niche where you can market to that specific population and provide specific services, whether it's groups, whether it's workbooks, or whether it's just one-on-one therapy sessions where you have that focus of care on that specific thing. Additionally, specialized treatment offerings can be another way to really kind of maximize your income in the counseling space. And so what that looks like a lot of times are EMDR intensives. It could be couples therapy intensives. It could be certain support groups or certain therapy groups around a certain goal or a certain topic. That can be a big piece of that kind of specialized approach where you have different treatment offerings that are outside of one-on-one traditional therapy. Also, as I said before, location matters. So if you live in a state that kind of has a lower cost of living, it's really helpful to get a license in a state that does have a higher cost of living, because it also opens you up to other remote opportunities in that state that has a higher cost of living. And it can be a great way to really maximize your income while also, still staying in a place that maybe has a lower cost of living. So you're able to really meet maybe some of your financial goals. Last but not least, being a program director or clinical director. And so there's a lot of options when it comes to all the roles that helping professionals can play in. That's nonprofit, managed care, wellness initiatives, and also health-based foundations. I've been noticing that a lot of times there's an overlap between kind of the public health space and being a program director or clinical director. If you do have a background in something different than a helping profession, it's also a great way a lot of times to market some of the other skills that you have. And so that can be kind of a great way to think about, approaching some of these roles. So when you are applying for roles like this, really make sure to just highlight a lot of your management or your leadership experience, and also highlight some of the skills that you've gained over the years that would make you a competent leader and also a competent program director. And so, don't say no to a lot of these roles. A lot of these can be high paying, and they also tend to be a mixture of sometimes hybrid, sometimes remote, and also sometimes on ground. So these can look different, but these can also be very high paying as well. So that is it for today. Thank you so much for watching this video. Please be sure to like and subscribe, and I will catch you on the next video.